Do you know what your CT heart calcium score is? Well, the lower your score, the better. And today, cardiologist Dr. Shoba joins us to discuss CT heart calcium scores and what we can do to keep that score as low as possible. Good morning.
Good morning.
It's good to see you. I haven't seen you in a while in person.
Good to be here.
We appreciate you being here. Let's talk about this. CT heart calcium scores, they're very important, aren't they?
That is correct. It is what tells us about the hardening in our heart arteries. Everybody is worried about whether they are at risk for a heart attack. And there are a lot of things we measure for your risk. For example, family history, smoking, diabetes, your cholesterol. But is there a test above and beyond that that tells us if you already have some plaque buildup in your heart arteries? And that one test is called that CT heart calcium score.
And like I said earlier, the lower that score, the better. What is the normal? Like if there is a baseline normal, what is a normal score for someone?
Normal score is 0. You
Right.
should not have any calcium buildup in your heart arteries. There should be no hardening in your heart arteries. So any number above 0 is abnormal. However, the higher the number, the worse off a risk for potential heart attack and blocked arteries. In general, it is said that if the score is between 100 and 400, there is sort of an intermediate risk.
Right.
But above 400, the risk is very high. A little bit about understanding what the calcium score is. What causes our heart attacks is the soft plaque or gunk that deposits in the insides of our heart arteries. When it is inflamed or we are under stress, a part of that plaque can suddenly rupture and a clot can form and cause a heart attack. Calcium buildup, on the other hand, is something that is deposited in our heart arteries as a measure of hardening. There are people who have calcium buildup without a severe blockage, and there are people who are especially young and have a bad family history that may have a very small calcium score. It may be 10 or 20, but they are young, they have a bad family history, poor lifestyle choices, and they still are at high risk for a heart attack from a blocked artery.
Are those lifestyle choices our key thing that we need to keep in, family history is important, but we got to take care of those lifestyle choices.
That is correct, because unless you take care of your diet, your plant-based products, your foods, your legumes, less, of the meats, less of the processed foods, stress, keep that under control, control your blood pressure, stop smoking. That is the key, because that is what prevents inflammation and heart attacks. The calcium score is, however, a very key tool to picking up if you have a blocked artery. It doesn't, for example, you'd go under a CT scanner and within seconds the machine will take a picture, and then the technician and the doctor will take a look at the pictures and give you a report that says, hey, your calcium score is 100. So what does that mean? And the higher the score, the higher the chance that you have a blockage, over 75% in your heart arteries. So what your doctor may do is they will ask about your symptoms, and they may recommend a treadmill test to make sure that in addition to having the hard calcium plaque, do you actually have a tight blockage in your heart arteries, and that may lead to further testing. But there are some things the doctor does to look for blockages, but there are a lot of things that we need to do at our end if we find the calcium buildup.
When should we approach our doctor and say, listen, I think I need a CT heart calcium score done?
I think, if you have a lot of risk factors, some of the things that we mentioned earlier, you're about 40 years old, and you really don't have symptoms, but you really want to get your health, back in shape, that would be a good time, 40 and above. But like I said, calcium can deposit even at a younger age. And it's a very simple test. It costs about $49 to get the test done. Oftentimes the insurance pays for it. Right. And oftentimes you can call the CT line and get the calcium score on yourself as well.
Dr. Shoba, thank you so much. Very interesting topic. And if you need more information, we have a number and a website right there at the bottom of the screen.